Good morning. This is Tina Drago with Healthy Las Vegas, coming to you from the Beasley Broadcast Studio. Today, and happy 2016, I have in the studio Vickie Byers. She is a physical therapist, a stroke team leader, and there's a whole lot of other certifications and specialists behind her. Very, very overqualified lady. Good morning, Vickie. How are you?
I'm good. Good morning. Thank you for having me here.
Oh, love it. Love it. So you're going to start our 2016 off, and you're going to tell us what we should be looking for, first of all, in a stroke. What's a stroke, and what are the signs and symptoms?
I think this is a very important topic for a lot of people because stroke is the number 5 cause of death in the country, and it's the number 1 cause of disability. And so it's very important to recognize what a stroke is and what some signs and symptoms are so that we can kind of prevent or delay some side effects that can happen after a stroke. So a stroke occurs when there is a reduction in blood flow to the brain. And this can be caused from several locations. A lot of times it can be caused by a blood clot that travels to the brain. It can also be caused by a clot of cholesterol. And then there's also something called a hemorrhagic stroke, which is actually a bleeding in the brain. And that can be caused by an aneurysm. You hear a lot of times people say, oh, they burst an aneurysm. And when the blood flow is reduced to the brain, oxygen flow is reduced to the brain, and essentially part of the brain, it dies. The neurons die.
Never to come back?
Never to come back. But not the whole brain, just a part of the brain.
Okay, hopefully the part you don't use too often? Or
Well,
usually no?
Unfortunately, it depends on where the stroke occurs. And
Okay.
sometimes these strokes can be catastrophic. And I think a lot of people think, oh, strokes only happen to old people. And that's not true either, because I've had patients from the ages of 12 on up to 90 have
That's
strokes.
scary.
Which is a scary thing. I mean, a few years ago, we had Jerry Tarkanian's grandson, who was like 8
Was that a
years old.
stroke?
He had a stroke.
That was all over Facebook. I'm friends with the family. That was really heart-wrenching.
And it's heart-wrenching to hear these stories. And a lot of times in children, strokes can be caused by something called an AVM, which is an atriovenous malformation. And it's just a malformation of the blood vessels in the brain, and one of them either bursts or collapses and causes a reduction in blood flow.
Is that something that's genetic or that they'll grow out of? Or is it
Sometimes it's genetic. Sometimes people don't even realize they have it. There's a wonderful book out there called My Stroke of Insight, and it was written by a neurosurgeon who had a stroke, and she had an AVM that she didn't know about it until she was, in her 40s.
And she's a
she had stroke.
neurosurgeon.
And she's a neurosurgeon. And the book is wonderful because it kind of talks about, it's kind of science-y, so if you really like science, it really talks about the science part of stroke and stroke recovery, but it also kind of gives the patient perspective.
So what would have been a symptom that this doctor or a family like the Tarkanian family would have been able to notice in their child?
Well, a lot of the literature out there likes to use the acronym FAST, F-A-S-T, and each letter stands for one of the symptoms. So F stands for face. Yes.
Okay.
So drooping on one side of the face. That's not a normal thing. If that starts happening to someone, you need to really consider that
Act quick.
We need to move on this, because drooping on one side of the face is not a normal thing. The A stands for arm, and this can be weakness in one arm or one leg. L doesn't fit into the FAST acronym.
No, it
but
doesn't.
It can be one side of one side of the body.
It could be appendage.
An appendage, yes, appendage.
Okay.
And then S is for speech, and speech can be slurring of speech.
Good example.
That's a very good example. Or difficulty coming up with the right words.
Mm-hmm.
And sometimes something called word salad. And that may be someone is trying to say, hand me that cup. And they say, toothbrush, bobble, head. And they think they're saying, hand me that cup, but the words coming out are not making sense at all.
Okay.
And the T is probably the most important thing, and that is time. If any of the symptoms that precede the T, the face, the arm, the speech, are occurring, it's very important that people get to the hospital. And
Don't drive yourself.
don't drive yourself. Call 911. Don't have someone drive you, because if you're in the middle of having a stroke, things can evolve very quickly.
Can you be cognizant, like if I started slurring my speech, would I hear that I'm slurring my speech?
You might. So it depends on what part of the brain is being affected.
Or
sometimes
if I go look in a mirror, if my arm feels like weak and I can't lift it up, if I go look in a mirror and try and look at my face or try to smile or anything like that, and I can't,
yeah,
then I should be aware.
You should be aware that this is not a normal thing. And I hear this so many times from so many patients. Oh, I thought I had a cold. I thought it was something I ate. I just wasn't feeling well. So I just thought I would fall asleep and, I would take a nap, wake up, and then see if I felt better. But the big thing is if people are having a stroke that's related to a blood clot, there's a special medicine that can be administered called TPA, and that breaks up the clot. And when that medicine is administered, the chances of having long-term disability are greatly reduced because you restore blood flow to the brain faster. But with the TPA, you have to have it administered within a 3-hour window. So these people that have these symptoms and they don't recognize them as stroke symptoms and they go take a nap or they just try to rest it off and they pass that 3-hour window, they can't administer the TPA anymore. So you just are now picking up the pieces after the stroke has actually done the damage.
Okay, so folks, personal experience. 10 years ago, my grandmother was a little dizzy, a little slurred of her speech and her arm. So she lay down and took a nap and literally went into a full stroke. She lost half the body movement on half of her side. She had to go into rehabilitation. It was a long road for her. And she was, I want to say she was in her late 60s, early 70s. Not old enough, had a lot of life left.
Mm-hmm. And I think, too, again, you have to keep in mind, it's not just something that happens to grandmothers and older individuals. It actually occurs in younger, I've seen more and more younger women, 40s, early 50s, and again, younger children with full-blown strokes coming to the rehab center to be rehabilitated because of whatever reason. And
is there any lifestyle choices?
Absolutely. There are definitely risk factors that you can avoid.
Okay, so let's talk about what some of those risk factors might be.
The first one, and I think this applies to a lot of people, is uncontrolled high blood pressure. If your blood pressure is too high, it causes roughening of the blood vessels, which gives a prime place for things to stick to. And when things stick to the blood vessels, they can create clots. And if clots break free, they'll travel to the brain, and then you have a stroke. So controlling your blood pressure is a huge
So this is my first stance. Everybody out there who's on blood pressure medicine, you have a primary care provider that is prescribing you your hypertensive medicine. You should not be out of control. You shouldn't accept any reason to be out of control. Your provider is educated to make sure that you are in control. And as long as you're following their care plan, you should stay in control. And if you're still out of control, find another doctor quickly.
And I think a really good piece of advice, and my father is a great example of this. He checks his blood pressure every day, twice a day, once in the morning, once in the evening, and keeps a log of it. And when you have this information in black and white and it's written down, this is the time, this was the blood pressure, this was the heart rate, you can take that information to your doctor and say, look, I haven't been feeling great, or I've been feeling wonderful, and this is my numbers. And having the physician actually look at these numbers instead of saying, oh, well, your blood pressure in the clinic is fine. Well, okay.
Well, you want to make sure
it'll be up, but
yeah, most likely your blood pressure is a little higher in the clinic because you're a little anxious when you get into the clinic. But also know that clinic blood pressure machines have to be calibrated also. And if they're not calibrated on a regular basis, because they get much more use than your private one would have, and most insurance companies will pay for a home-based blood pressure machine that's very simple to use. I can even use it. So, if I can use it, anybody can use it. And you should look into that because those are things that your insurance will cover for you.
Absolutely. So that's a big one. Another big one is uncontrolled diabetes.
My nemesis.
It's like the trifecta, I think. I think there's three that are the trifecta: the blood pressure, the diabetes, and then the atrial fibrillation, which we'll get to. But the diabetes, the reason why diabetes is so linked to stroke is when you have excessive blood sugar running through your blood vessel, it's sludgy.
It's sludgy blood.
And also it's sugar crystals are sharp.
Yeah.
And they can nick blood vessels. And when blood vessels are nicked, they have to clot so that you don't bleed out.
Right.
And so you have all these opportunity for clots to form because you have all these little sharp crystals of sugar running through your
guys-
sludgy blood.
Do you remember making rock candy as a child, where you put the string in the
Absolutely.
sugar water and then it crystallized around it? Basically, when you're diabetic, that's what you're doing to your blood. I don't know how else to give a visual,
I think
but
that's a great example because
but when you think about it, you want your blood to be free flowing and get into all the small veins, because that's where you lose your feeling in your feet and your eyesight becomes an issue. All those tiny, tiny veins, you can't when it's sludgy. My biggest problem, and I know if you're listening to my show, you hear me say it all the time: hypertension and diabetes and weight are controlled. These are lifestyle choices. People, you've got to do better for yourself. These are choices that you can make to decrease your health or increase your health.
And we only have one life.
Exactly.
So you make the best of it.
Make the best of it.
And the things that you can change, you should change. And you can help with your hypertension and your diabetes, not just with medication, because medication is wonderful, but making lifestyle changes, making diet changes, those things are super important. And, I'm a physical therapist, so I don't do a lot of advice with dietary stuff because that's kind of beyond the scope of my practice. But, working on eating more healthy and there's plenty of websites out there that will give you healthy choices that are free.
That are free. Yes. You don't have to pay to get information out there. And we need to take better care of ourselves.
Absolutely.
And I'm a huge adversary of take a pill and make it go away. Because then they have a pill for a pill and another pill for another pill.
Mm-hmm.
So.
But then, and we'll talk about that too when we talk about stroke recovery, because we're in such a society where there's a pill for everything, and people think that there's a pill to recover from a stroke, and that's really not the case.
Physical therapy and a pill do not equal.
No,
it's hard work and physical therapy equal. So what happens after you have a stroke?
Well, initially when you have a stroke, you're going to go to an acute care hospital. Like Summerlin Hospital or Sunrise.
So our normal hospitals
that are here in town. Most of the hospitals in town are stroke centers, which means that they have the technology where they can administer the TPA. They have a neurologist on call. And that's where you really want to go. You want to try to get to a center that's a stroke center. And most of the major hospitals here in town are stroke centers. So you're pretty much covered wherever you are in the valley.
So I just want to say this because it happens probably weekly. Do not go to your private practice doctor. I have people come into our medical clinic, First Person Care Clinic downtown, and they come in and they are actually in the middle of a stroke or a heart attack. Please go to the hospital. This is where you need to be for the best care.
And so at the hospital, they're going to stabilize you. They're going to, if they can, administer the TPA. If they can't, sometimes if you have a bleeding stroke, the hemorrhagic stroke, they may be able to do a brain surgery on you to stop the bleeding. They'll get your blood pressure under control, because most likely your blood pressure will be high, like in the 200s, over 100. I've seen a lot of those numbers. And they'll get you stable so that you're not going to die.
Good. That's a good thing.
Which is a good thing. We don't like to die. And so then after that, usually you're going to be discharged to a rehabilitation center. And
the best one in town is?
Of course, it's HealthSouth Desert Canyon.
Of course it is.
And I highly recommend for especially if your family is in town, that they go and check out whatever rehabilitation center they're thinking of going to. If it's our facility, that's wonderful, because that's my passion, to work with stroke survivors. It's just something that's so rewarding, and it never gets old, and every person presents with different challenges and impairments, and it's the best part of my job is working with stroke survivors, but really going to the place and checking it out.
You can walk in there. You don't have to you walk in there and say, I'd like a tour. I'd like to know what's going on. If your family member is at a rehabilitation center that you maybe not be comfortable with, or maybe it's not what you're looking for, go out there and research. And they'll give you a tour. I walked in and I got a tour, and it was very impressive.
Yeah,
very
so
impressive.
It's important also to ask the right questions for the rehabilitation centers, because they're not all alike, and there are some places in town that put the word rehabilitation in front of whatever their name is.
A skilled nursing facility.
And they're not technically, legally, under Medicare rules, are not following the guidelines of a true rehab center.
So what should they look for in a true rehab center? Because I've seen both sides of it. A stationary bicycle does not make them a rehab center.
Right. And that's important to know, and it's important to recognize the intensity of the therapy that the patients are getting. And it's actually just a differentiation between skilled nursing and rehab. And skilled nursing, patients are not required to be seen for a certain amount of hours, whereas in rehab, patients are required to be seen 3 hours a day, 5 days a week.
Say that again, because that's really important.
It's a very important thing. 3 hours a day, 5 days a week. So at our hospital, we say 15 hours a week because we do have therapy on the weekends for some patients. And sometimes we'll spread out that 15 hours so you get a little bit more.
In the earlier days, and they need to build up.
Some people aren't tolerating the 3 hours a day. So that's an important thing. How many hours of therapy does a patient get a week?
So if they're telling you 2 to 3 hours of therapy, a half hour a day, things like that, that right there should be your first sign that they're not in a, quote, rehabilitation facility. They're in a skilled nursing facility that tries to administer physical therapy to their patients.
And that's fine. That they do,
and that's a good thing for that.
Good thing. And at Skilled, they do have physical therapy and occupational therapy and speech therapy. They do have those services. It's just not at the intensity that something that is truly considered a rehab does. So that's a big difference.
So also for us laymen out there, look at a skilled nursing facility. Their physical therapy, occupational rehab protocol is to maintain that person so that they don't decline, because they're sitting in a bed all day. So they have to get up and walk, and they have to get up and do things, otherwise they'll decline. But in a rehab facility, your goal is to get that patient healthy and out. In how long?
Usually at Desert Canyon, our average length of stay is about 12 days.
Wow.
It depends on, of course, insurance and insurance authorization and the acuity of the patient. The sicker the patient is, a lot of times the longer they'll stay.
But 12 days is an in and out.
12 days is a quick thing. With our stroke survivors, generally, it all depends, of course, on the insurance.
And the individual.
And how the individual is progressing and tolerating and things like that. Our stroke survivors get a little bit more time, but not much. And, our goal is to be as efficient as possible, because no one wants to be in the hospital. No one wants to be in rehab for a long, long time.
No.
If it
but
was
your rooms are nice, and
our rooms are nice.
Your rooms are nice, and you actually have this chair that folds out into a little bed for like a loved one or a spouse or a family member to be with them. So that's cool too, because that keeps their spirits up.
Right, and we all, at our facility, we really encourage the family to be a part of the process. And as far as the stroke team goes, my philosophy and everybody that's on the team, our philosophy is we do not do rehab on you. We are your coaches, and we will guide you through the rehab process, but you will put in the work, and your family will help you put in the work, not only in your sessions, but after your sessions. During the time when you're in your room, you will have homework to do. You will have things that you need to work on from every discipline, because it's not just physical therapy. It's physical therapy and occupational therapy and speech therapy. And it's the sum of all of those parts that help rehabilitate a person to the whole that they are.
Exactly. If you can't communicate with your family when you go home, it's going to be difficult.
Right.
So speech is important for that communication.
And even swallowing. A lot of times after people have a stroke, they have a difficult time swallowing and regaining. When you have weakness in one side of the body, part of the muscles are the muscles that help you swallow, and those can be weak too. And so a lot of times people can aspirate, and speech therapy works on the swallowing, the cognitive part of things, and also the speech, because sometimes you will lose the ability to speak depending on which side of the brain your stroke was on.
So what resources are available at Desert Canyon?
So at Desert Canyon, we have both inpatient and outpatient services, which is very unusual because there are not very many outpatient clinics in Las Vegas that deal specifically with neurological conditions. There's a lot of outpatient physical therapy clinics, and they are wonderful at working with orthopedic patients, people after knee surgery, and those
hip
types
surgery,
of things.
Things like that.
Backs, all of that kind of thing. But when it comes to a specific population like stroke, there are not very many clinics in town that have the people that are qualified to do the neurological rehabilitation. So we have the outpatient services. We also have the inpatient services. We have speech therapy, occupational therapy, physical therapy. We have a great team of case managers that help manage the cases. We have a support group, and our stroke support group is completely free. You get free lunch.
I love that.
Anything free. I love free.
But it keeps you coming back.
It does keep you coming back. We have speakers. The support group meets on the second Wednesday of the month at lunchtime, and you get lunch, and we usually have a speaker. Sometimes it's a general discussion, problem solving, that type of thing. And we sit and talk. It's a great group of people that get together. Some of these people I've known for about 4 years. So it's really a nice group of people that we get together and we talk and we get to know each other. And we talk about the problems that face people that are recovering from stroke, because even after you leave the rehab hospital, there are still barriers and challenges and things that you have to overcome or learn to compensate for. And so having a nice network of individuals where you can bounce ideas off of each other is important.
Rearranging the house. That was probably the biggest eye-opener we had. My grandmother would always go downstairs to do the laundry. Mm-hmm. Well, the laundry came up, and, it's like just because she did not want anybody else doing that task. That was important to her.
What's really interesting and kind of refreshing to me is, as a physical therapist, I think, oh, this is the right way to do it, or this is the way I would do it. And there's so many, it's nice to see other people who are in the situation, like, okay, my left arm is still not functioning the way I would like it to function, but I need to accomplish this. And my solution is probably the most wrong solution. And the rest of the stroke survivors say, well, I do it this way, and I do it this way, and I do it this way. And having their input for the new stroke survivors, like, oh, I never thought of doing it that way. But they've been in the situation, and so they realize, okay, this is what works.
You have an aquatic center there. I've never seen an aquatic center here in Vegas.
I'm actually an aquatic certified therapist, so I do aquatic therapy. It's not a very big pool, so if you're thinking like Olympic-sized pool,
well, you're not doing laps.
It's definitely more of a therapeutic pool. It's meant for balance training and gait training and that type of thing. It's not a swimming pool. It's more of a therapeutic pool. It's kept at a balmy 93 degrees.
Loving it.
So it's like a hot tub, kind of.
So what brought you to Las Vegas? Give us the story.
Well, I'm from New Mexico originally, southern New Mexico. And when I was 19, I got offered, I wanted to be a ballerina.
Okay.
And so my whole life I trained and danced, and I thought I was going to be a ballerina, but I grew too tall to be a ballerina. And I got a small little job to work in Japan, working in a couple of little showgirly type shows in Japan. And one of my coworkers said, you should go to Vegas. And in Vegas, you should audition for Jubilee.
I love it. Because if you look at her, she's tall and thin, and I could totally see her with a big headdress on.
So I came to Vegas, much to my mother's chagrin. And I auditioned for the show in Vegas at Jubilee, and I got the job. And then I worked as a professional dancer here, like a real dancer.
No poles?
No poles.
No poles, okay.
And I worked here as a professional dancer at Jubilee. I worked at Excalibur at the Tournament of Kings show.
I love that show.
It's a great show. My husband actually is still working there. That's where I met him. And just loved Las Vegas, so I stayed here. And I decided probably when I was in my 30s that I probably needed to get a different job.
Oh.
And so I had always thought I would do something in medicine. So I went to UNLV. I thought it was going to be sports medicine. I went to work for like a professional sports team. And
why not?
Well, why not? Because that's not far-fetched.
Well, yeah, but most of our orthopedics and sports doctors work on the people in the shows here in Las Vegas. Yeah. The Cirque du Soleils and all of those shows.
So I actually ended up going to the physical therapy program after I got my bachelor's degree at UNLV and graduated there with my doctorate in physical therapy and did my first clinical rotation at Desert Canyon.
And we love that you're staying here in Vegas.
I just love it here. And I just fell in love with the neurological population and knew that I didn't want to work with athletes anymore. I wanted to work with people recovering from stroke and spinal cord injury and those types of disease processes because it was just so rewarding.
So, and as a somebody in the healthcare field in Las Vegas, we are happy to have you. She's really, really qualified. I won't go down all the list of things because it'll give her a big head. But, but I think it's wonderful that we have phenomenal providers in our community that are helping out the average person that needs their care. Thank you.
Thank you very much for having me.
You are welcome. Well, this is Tina with Healthy Las Vegas. First show of the year. I think we're going to have a great 2016, and here's wishing you all well.
For information, please call HealthSouth Desert Canyon at 702-795-5820. That's HealthSouth Desert Canyon at 702-795-5820.